Welcome to the Birth Journeys podcast. I'm your host, Kelly Hoff, BSN RN. I am a wife, a mother of two, and a nurse specializing in the care of women and newborns. In this podcast, we will share powerful journeys of birth givers with the goals of lifting the veil on the birth experience, healing through sharing, and beginning an open conversation to strengthen trust and promote transparency between birthing people and healthcare providers. Hello. Today I have with me Maja Miller. Maja is a metabolic health coach and functional diagnostic nutrition practitioner. That's a fancy way of saying that she uses clinical labs to analyze blood, urine, stool, hair, etc. to find out why her clients feel burned out, exhausted, and sick. She then uses those results to create tailored bio-individual protocols to reverse their symptoms. As the owner of Maja Miller Wellness, a six-figure business, she helps highly productive individuals and ambitious professionals transform their bodies from the inside out through her signature programs like the Adrenal Detox, the Inside Out Protocol, and Next Level. Over the course of her career in wellness, she's worked with over 10,000 women, 1,500 of which have been within her online programs. She's been a podcast guest on many shows, including Low Ticket, High Impact, Ideas and Impact, The Mind Fuel Entrepreneur, and Ideas and Impact with Jeremy Jones. She's also been featured in print in Forbes, Austin Fit Magazine, and the Austin Business Journal. She lives in Austin, Texas with her husband, son, and pups. Maja, welcome and thank you for joining me.
Hello, so happy to be here.
I am really excited to hear your birth journey and how your career in functional nutrition has impacted your fertility journey.
Man, well, I'm an old first-time mom. So I just had my son 5 months ago. His name's Noah. He's an absolute dream, but I am also 45 years old. And so not a young mom, I would say. Not old, but not a young mom. And I married my husband later on in life. We didn't want to have kids right away. And so we decided just to do IVF as kind of an insurance policy. And I'm so glad that we ended up doing that because what ended up happening was my entire life exploded. I lost my dad. I almost lost my mom. I had to shut down my business because I was dealing with so many family things. It was an incredible amount of stress. And I knew that with my functional kind of nutrition background, I knew that that level of stress was not going to make for a great pregnancy and could definitely impact the baby negatively in my postpartum time. And so we decided to wait. And then we had a global pandemic where I wasn't going to have a kid in the middle of COVID. So really, I ended up, postponing my birth by 5 years or so. And so I was very happy to have had those genetically tested embryos on ice ready to go. I think one of the most important things about my birth journey is the amount of work that I put into making sure that my body was healthy, that my nervous system was calm. And I probably, waited a year and a half, almost 2 years after all of the craziness to even consider implanting those embryos. I really wanted to make sure that my microbiome was nice and healthy, that my hormones were balanced, that I had eliminated almost all stress out of my life. And that took a significant amount of time, but it really paid off because I had probably the easiest pregnancy in the world. I had no morning sickness. I had no emotional ups and downs. My pregnancy was just an absolute joy. And while my birth was not what I expected, it was also pretty easy. We implanted an embryo last summer, and it took, after just one implantation, which is pretty rare, only about 4% of women over 40 have successful IVF outcomes. So the first time that we implanted our embryo, I worked with an amazing midwife here in Austin, Texas at the birthing center. And I was going to have like a granola, no epidural, feel all the things birth. And Noah had just a different plan in mind. So right around 41 weeks, I started getting just an intuitive hit that I was going to have a C-section. And I remember being in the shower and having a conversation with Noah saying, hey, this is what a hospital C-section is going to look like. And this is what a midwife birthing center birth is going to look like. And I told him, I trust your wisdom that you're going to choose your delivery exactly how you need to be delivered. But I still really thought that he was going to pull it together and we were going to have a regular vaginal delivery at the end of 41 weeks. Well, at the beginning of 41 weeks, we start doing all the things, the mile circuit. I do 2 rounds of castor oil sex in order to get things going, and just nothing was happening. I did 2 membrane sweeps. I mean, really unheard of. My midwife said that she 1 round of castor oil works for about 80% of people. And so that Wednesday before I inevitably check into the hospital, I completely lose it. I'm in the middle of the night and sobbing. My husband is like, you just need to let this all go. And I think that was the moment where I really realized I was going to have a C-section, something I really did not want to do. And it was Saturday night. I told my doula, I said, and my husband, I said, hey, because at 42 weeks in the state of Texas, your midwife can't see you anymore. You have to transition to a hospital. So it was either give birth for the first time at home on my own with no medical support, or go to the hospital. And I chose the latter. And the night before we went to the hospital, I told my doula and my husband, I said, hey, we're going to get to the hospital. The induction isn't going to work and I'm going to end up having a C-section. Sure enough, it's Sunday. I'm now 42 weeks in 1 day. I've officially turned into a pumpkin with my midwife. All of us head to the hospital. Then I check in, and first induction, they give you a round of cytotech, I think it's called, to dilate your cervix. That didn't work. 6 hours later, that didn't work. And I'm really proud of myself actually for how I was able to handle this decision. I had planned on no interventions, natural childbirth, no epidural, because epidurals impact breastfeeding and a lot of other things. And so I kind of lost it when I got to the hospital. I mean, I started crying, and there's a wonderful midwifery program in the hospital. And the midwife was like, okay, explain the tears, talk to me about what's going on. And I just said, I don't want to be here. In general, I have a general distrust of allopathic medicine, and especially obstetrics in this country. I believe that many women have traumatic births because OBGYNs are involved. And so this was the perspective that I came from, where a lot of my clients have had very traumatic, awful births. They aren't listened to. The doctors do what they want. They're coerced into interventions. Those interventions are part of an intervention cascade. And so and they end up getting C-sections, and I didn't want that to be me. And there are definite implications for baby microbiome from C-sections. Your baby gets about 16 to 20% of his or her microbiome from vaginal delivery. And so I knew that there were just implications. And by the way, just getting sliced open is also kind of a major thing. The midwife was really amazing. And she just said, I've been a midwife here, but I've been a midwife at home and in birthing center environments. Tell me what's important to you in your birth. And so I got to say, what's important to me is optimal cord cutting. And we had a negotiation around that, and we ended up with delayed cord cutting. And there's a difference between the two. I said, I want immediate skin to skin unless there's a medical emergency. I want my husband in the room. I want him to be able to cut the umbilical cord. And so she just said, we're going to do all of that for you. And I really appreciated that. But then because I was, a 45-year-old mom that had gone 42 weeks in 1 day, I'd had 2 biophysical profiles, so BPPs, in the prior week to make sure that everything's okay with Noah. And she came in and said, hey, by the way, the second round of cytotech isn't working. I just read your last BPP. This child is going to be anywhere between 10 to 12 pounds. At this point, we have to recommend a C-section. And I just said, hey, walk me through both options. And she's like, okay, well, option 1, we continue the induction. It's not going so well right now. You will probably need lots of Pitocin. That's going to stress you out. It's going to be more painful. It's going to stress baby out. He is gigantic, so there's a significantly higher likelihood that his shoulders get stuck. In that situation, 2 things will happen. We will either break his clavicle in order to get him through your birth canal, or we will shove him back up through you. And now you are in an emergency C-section, and all of those things that you just outlined as very important to you are off the table, because now you're going general anesthesia, your husband can't be there, all the things. So right away, I just said, okay, let's go. And I think she was really surprised that this like crunchy granola mom who was going to have like a natural birth just so quickly said yes. But I just explained to her that I had had a knowing for the last 2 weeks that this was going to happen. I'm very in tune with my intuition and I listen to it always. And so she even said like, wait, are you sure you want to do this? And I was like, yes. And for me, if I had 100% chance of having all the things that were important to me versus, a 30% chance of not having that, to me, that was like one of the earliest parenting decisions that I could make. I decided that at this point in my life, I wasn't going to choose suffering, just to make a point that I had a natural childbirth with no epidural. And I went through all the pains and all of that. So I just listened to my gut and my intuition. It's never, not once ever in my life, made me go astray. And within a couple of hours, I had Noah in my arms. It was the C-section was kind of wild. It's a pretty aggressive surgery. My husband, after the fact, said, you were trying to be so calm and there's just like a tear, kind of streaming down your eyes. Cause I was very surprised at like how, I won't say violent, but definitely aggressive that surgery is and your body's being yanked all over the place. But I had very little pain and we really practiced once we brought Noah home, some of the birthing kind of postpartum traditions of sitting in. I only left the house, I think maybe once or twice, I think for pediatric appointments. But after that, it was all about recovery and getting more my minerals and my macronutrients and my micronutrients and making sure that I was very well taken care of because taking care of mom is taking care of baby. So I've had an amazing postpartum as well. No hair loss. Noah was sleeping through the night as of I think about 1 or 2 weeks in. He was 10 pounds when he was born. So in fact, he was a big baby. He's the happiest little boy ever. And gosh, I can't believe even for 1 second that I used to think that being a mother wasn't going to be enough for me because it's literally like the best thing I've ever done in my life. And I can't wait to do it again. I emailed my doctor 6 weeks in and I said, hey, when can I do number 2? And she thought I was crazy. But so I've really had everything from implantation to postpartum has just been really easy, breezy, and very flowy for me.
That's amazing. I really love how you described that you transitioned through your birth decisions. And I think it really highlights how we can do right by women by helping them understand the choices versus throwing it out there as this is the only option. You still came to the same conclusion that your OB was recommending. So this is a huge reason why I'm doing this podcast, because I think it's all in the presentation and in our duty to educate versus this culture that we've had for centuries where women don't know their bodies and we need to tell them how to do things. So, Well, first of all, I want to go into a little bit more detail about a couple things in your C-section, how that went for cutting the cord and what they actually allowed you to do within the operating room. Did he cut the umbilical cord, or was it a situation where they let him trim the umbilical cord later? Did you do immediate skin to skin? How did that go for you?
Yeah. So we did everything except for my husband didn't cut the umbilical cord. I don't recall if it wasn't an option or if things just got intense and he didn't want to. I think just nobody offered. And so I think he kind of was just hanging out close to me, but I got the baby right away. The baby was on me while they were sewing me up. So all of the things that were very important to me happened.
I'm curious. First of all, I'll comment on the umbilical cord. Just because there's a sterile field, usually it's not an option in most facilities. I've heard what may be urban legends about people being allowed to cut the umbilical cord that are not trained surgeons or what have you. I'm not sure what that would look like. I think whoever is going to cut the umbilical cord would probably need to be scrubbed in and standing right next to the surgeon, which is obviously, we would have liability issues in that regard. However, what we've done in the past, and possibly this is what wasn't offered to you, sometimes dad can trim the umbilical cord. So that's in some of the facilities that I work at, not all, depending on the layout of the OR. Dad has that.
Dad did not touch the umbilical cord, and I think he was fine with it. So
okay,
yeah, whatever.
It is kind of disconcerting once you do see the umbilical cord. It's a little, it's gooey and weird.
A little gooey. Yes. Yes.
Most dads are like, oh, I wanted to do this. So I'm impressed that you were able to do skin to skin. And I know there I don't work at a facility where immediately the baby goes on mom. I work at one facility where we do skin to skin with dad as an option after the pediatrician has evaluated the baby. So I'm just curious because I'm not entirely sure how that process works at some other facilities. I would imagine it's different at so many different, but was there a nurse there that was helping you do the skin to skin? Because I know that things get there's just not a lot of space for that.
I don't remember. I know that I was still on the operating table and baby was on my chest, but I made it a point to say we passed on Hep B, we passed on the eye ointment. I essentially said nothing is to be done to the child unless there's a medical emergency. And that was very important to me. Mm-hmm. And so, I think that if you aren't educated on what your rights are as a mother, I think oftentimes options are not presented. What is presented is what's most convenient for the medical team and what it has the least amount of liability for the medical team. But that isn't necessarily what's good for baby and what's good for mom. And what's good for baby and what's good for mom, short of a medical emergency, is that baby is on you right away.
Correct.
I'm constantly hearing stories of mothers who struggle with breastfeeding. They're not producing enough milk. That is a direct correlation to how quickly you get the baby, how long the baby stays on you. I know we talk about the golden hour, but it's really a couple of hours. Mm-hmm. And so I think that for me, because of what I do for a living, and I work primarily with women and most of them are moms. I would say 80% of my clients, 90% of my clients are also mothers, in addition to whatever they do outside of the home. For me, knowledge is power, and it helps me feel less anxious about something that I was very anxious about. I was very nervous to deliver a baby. So I did a lot of work on the front end so that I was able to push back where I needed to push back. Because I think oftentimes we're in this vulnerable position. We're scared. We've never been there. We may be in pain, and we maybe don't have a doula. We don't have somebody that is kind of, has earned their stripes and kind of knows the system and knows where you can push back and not. And I think as women, we often give away our power. And so for me, I was able to do that because of the work that I had done ahead of time. And also, being an older mom.
Right. Yeah, I think there's an importance of informed decisions. And so maybe not that there's one right way, that every mom gets to understand the pros and cons and choose what works for them, just like you chose to, with all the information that you're given, ultimately, that it was better for you to have that C-section because you got 100% of the things that were important to you in that delivery. And I think that everybody should have that opportunity. And it's important that everybody educates themselves and then chooses for themselves what's important, and then is able to be flexible with the plan when some of those options that were preferable, slowly, sometimes they get taken off the table just because it's not safe. Or just because, like what you were saying, the option for the vaginal delivery was taking the things off the table that were important to you. So it's like you're weighing all of these different options and deciding what combination works best for you as a person.
Yeah. No, and had I not had this like intuitive, hunch, I knew that I was going to have a C-section 2 weeks before it happened.
Yeah.
And so had I not had that kind of intuitive hit, then I probably would have continued with the induction and we would have just waited it out. But I knew that this was going to happen. And I decided that, I could have suffered and still had the same outcome more than likely. And I chose something different, which is a really big deal for me because in the past, I probably would have been like, grin and bear it, no pain, no gain, pull yourself up by your bootstraps. And that just, I don't think it would have served me in this situation. And so, I think that going into any sort of medical decisions as a woman, it's very important that you understand what your options are and where you can and cannot push back. And at the end of the day, you have to give consent to anything that happens to your body. And so I would say there was one situation that I didn't love in the hospital. And I think I'll bring it up because it's a good example of this. So for some reason, they do 3 blood sugar tests on newborns. And at this particular hospital, they were fasting.
It was standard at that hospital?
standard at this hospital, not because he's a C-section baby, not because I was an older mom.
No, because he was large. How big was he?
So he was 9 pounds, 14 ounces. So essentially, 10 pounds.
That's large for gestational age. So that puts him at risk for not being able to maintain his blood sugars after delivery.
So my understanding is that they do this with all babies at this particular hospital. And what they do at this particular hospital, which they don't do at other hospitals in Austin, and this is coming from one of the nurses, I'll kind of tell you the whole story, but is that they actually do fasting. So I would feed him and then they would wait 3 hours and then they would check his blood sugar. Well, the first one was fine. The second one was 1 point below where it was supposed to be. I don't remember the number. But then all of a sudden, so they used the glucometer in my room, but they also did serum blood sugar. And somehow there was like a 13, 14 point difference between what they got with the glucometer and serum. And so the nurse practitioner came in and it's like, we need to give the baby formula. And I said, well, talk to me, what's going on? She said, his blood sugar is really low. And I said, really, it's only 1 point low. And I'm looking at like whole baby here and he's waking to feed. He is not lethargic. He's acting exactly how he's supposed to. What are the options here? And she goes, well, I could take your child and I can check him into the NICU and give him sugar water. To me, I took that as a threat. And my midwife happened to be visiting because this is, I think, like the second day in the hospital. And the nurse practitioner said, at this point, your child actually needs those things. And so I looked at her and I'm crying at this point, right? Because I'm upset and this has been a conversation and it seemed very threatening at this point. And so I just said, I need you to leave my room. I need 5 minutes to talk this decision over with my midwife and my husband. And my son is like totally fine, not in distress. My midwife is there and she goes, the birthing center is 15 minutes away. I'll go get you some breast milk. That's great. So the nurse practitioner comes back in and says, which of the two options did you decide, NICU or formula? I said, neither. My midwife has already left. She's going to be here in 15 minutes with donor breast milk. And then at that point she said, well, you know that this is dangerous. It's a bodily fluid. And I kind of like lose it at this point. And I'm like, are you looking for a solution here or not? Because this gets his blood sugar up, right? And it was interesting because when she left the room, the nurse looked at me and said, you keep fighting for what you believe in, mama. Ooh. And I, at that point, decided I was going to feed my baby right before I wasn't going to fast him. And I had this conversation with the nurse practitioner. I said, look, I'm a nutritionist. And when my clients have low blood sugar, this is a volume issue. He just needs to eat more often. And why are you fasting him? Like, what's going to happen, this is a normal mechanism, is he's going to have low blood sugar 3 hours after he eats. And that blood sugar is going to get him up and have him cry or whatever. And that's going to be a sign that he needs to eat again. And so she was like, well, it's different with babies. And I said, oh, really? Well, here's how the cortisol blood sugar reaction kind of works in adults. I'm always looking to learn more. Can you explain to me how it's different in a baby? It's not. It's the exact same autonomic nervous system, right? And she literally looked at me, turned around and walked away. And because she knew that it wasn't different. And one of these other nurses was like, I don't know why they're fasting your kid. And I had already decided because at this point I said, we're done with you get one more blood sugar test. Stop pricking his feet. And so the nurse was like, I'm going to be back in here at 11 o'clock and 1 o'clock and feed him right before. So I even had nurses kind of telling me like, hey, this nurse practitioner is being crazy and they don't do fasting blood sugar at any of the other hospitals I work at in Austin. So it's just one of those things where it's like, okay, I'm obviously, this is a traumatic situation. I don't want to feed my child formula with that particular formulation. And I understand the importance of like baby microbiome, and he's already a C-section baby. That's just an incredibly stressful way to start life. And so in that situation, I even asked, I said, hey, they've never presented breast milk as an option, which they happen to have in the NICU. They could have easily given me breast milk. Instead, I had to have my midwife go to the birthing center and bring breast milk back. Same thing, we said no to the vitamin K shot, and they said, oh, well, by the way, we have a preservative-free vitamin K shot. And I'm like, why is there a secret in and out menu here? Why do I have to be highly educated and have a personality type that I don't mind swinging my weight around in order to get what I want, which is not very typical for many women. So it's like those two things happen. And it's like, okay, had I not been educated on this, had I not had a midwife standing next to me, then that could have gone very differently. And the reality is, so these decisions that we make very early in life for our children have lasting implications for generations to come, and they are being stolen and taken away from us.
Are you pregnant and planning a hospital birth? You don't need a birth plan. You need a birth vision. In my opinion, birth plans set you up for failure. Yep, I said it. Hear me out before you turn off this podcast. You may think that by downloading a generic birth plan, it means you're in control. The truth is, it's not that simple. No one can control exactly how their birth will go. There are way too many variables. What every pregnant person wants is to walk into the hospital pregnant and to walk out with a healthy newborn in their arms. The journey in between is the murky part. It's hard to know what issues might come up that need to be addressed. If you focus your energy on a birth vision rather than giving your power to a birth plan, you can empower yourself to make the best choices for you and your baby. That's why you need to get into my Empowered Hospital Birth program. As a labor nurse and mindset coach, I can help guide you through the process of maintaining the calm autonomy that will help you achieve the birth vision you desire. In my Empowered Hospital Birth program, I will help you identify the source of anxiety you have surrounding hospital birth, fill in knowledge gaps to make sure that you are fully informed and confident, learn key phrases so you can better communicate with your medical team, emotionally process your fears so that they don't hold power over you. Go to kellyhoff.com/empowered to book a free 30-minute private birth vision call, where we will identify your top fears and must-haves and gain clarity on exactly how you want to feel in the birth space. That's KELLYHOF.com/empowered. I'm honored to be a part of your birth journey. Yeah. Wow. I'm just shocked that they were doing the 3-hour fasting. It's not evidence-based. And as you were talking, I was like, well, why did you have to go through the birth center to get the breast milk? One of the hospitals that I work at does have the donor breast milk for babies that need it. We also have the backdoor vitamin K because in the NICU babies get the preservative-free vitamin K. And then the drops we don't offer just because the American Academy of Pediatrics, the studies have shown that there's less of a absorption of the vitamin K with the drops. But regardless, you're giving your baby vitamin K. So yeah, we should be able to educate ourselves on the options and have the options presented to us.
What does that mean, right? Why am I having to practice defensive parenting right away? It's kind of like defensive nutrition, where it's like, okay, now something is grass-fed but not grass-finished, which is just as gross, right? So now you have to say 100% grass-fed and grass-finished. Free range is different. Now it's got to be pasture-raised, right? It's like the second that a consumer says, I am not okay with food this kind of way, right? Then they say, okay, they use a new term, and we're constantly having to like
fool us.
One up and fool. And so, I had a really big problem with this one particular nurse practitioner. Everybody else, like the nurses were amazing. Like that midwife was amazing. It was just this one particular nurse practitioner that really I felt like was kind of stepping outside of her bounds. And this is why I believe we have to empower ourselves with information as mothers so that we understand the implications of these decisions. One of the other things that I did, which, all credit to my midwife, I did vaginal seeding with my son. So as soon as we knew that he was going to be a C-section baby, I asked the midwife for sterile gauze and a sterile swab, and you put it, up into your vagina and get the bacteria that's in your vagina. And when the baby's born, you put it on his hands and on his nose and his mouth and kind of around his eyes so that you seed the gut microbiome that he would have naturally had exposure to had he been vaginally delivered. And I appreciate, there was another nurse in the room, and the midwife looks at the nurse and she goes, earmuffs. And the nurse goes like this. And she's like, this isn't something that we normally do, but yeah, go ahead. Here's here's a sterile plastic bag, here's your sterile gauze, and like, let's go for it. And so it also highlighted to me that maybe, I've got these kind of negative perceptions of allopathic medicine. And, here was a really great midwife and some really great nurses, and that maybe I had gotten it a little wrong in this particular situation. But had I not been as educated as I was, I wouldn't have known the difference, right? And
Exactly.
again, like, why is there a secret in and out menu at the hospital? Why aren't all babies being given the quote unquote preservative free vitamin K shot?
Mm-hmm.
The reality is you have to either have a lot of time or money in order to know this stuff. That means that there's a whole subsection of the population that these choices aren't even available for.
Mm-hmm. Yeah, it's maddening, especially working at the hospital, because I can only do so much as a nurse. Sometimes it is just empowering moms to make that choice and letting them do what they need to do. Well, first of all, I just want to clarify your group beta strep status, I would imagine, was not positive. Okay. Yeah. So correct. As far as vaginal seeding, if your baby is coming through your vagina, your baby is going to be exposed regardless of your group beta strep.
Positive or negative.
Positive or negative, right. They would have given antibiotics had you been positive if you had had a vaginal delivery. So there is evidence that, yes, that is an option to do vaginal seeding. Whether it's a policy at the hospital, that's a different story. So that's something that it's like, just like if you want to keep your placenta, that's on you. That's not something that the hospital will just provide as a standard. But there's other options of what to do with your placenta too. So, I mean, I've noticed that hospital policy does not necessarily keep up with the latest evidence.
Yeah. Just because the hospital has a policy does not mean that I am forced to adhere to that policy. And correct. I think that that's another misconception that, that a nurse or a doctor or some administrative person says that's not our policy. And I have to like cower to that and say, okay, well then do what you need, do what you need to do. The hospital policy is not put there for the best outcome for mothers. The hospital policy is there to mitigate risk and liability for the hospital.
And there's some things that like hospital policy we can't waver on, right? Your husband can't do your C-section. That's a hospital policy, right? But if it's a hospital policy I don't even want to pretend that formula thing was a hospital policy. I can't wrap my head around that. But there has to be an alternative, right? There has to be, if you're just 1 point below your blood sugar, it seems like there should be some other options. You know what I mean?
Also, when blood serum sits around in the lab, there's degradation to the blood. And oftentimes that's there was, I think, a 13, 14 point difference between the glucometer in the room and the blood serum glucose test. Because they would, do it in the room and they would send it off to the lab as well. And again, I brought that up to the nurse practitioner. I said, well, typically, because I run blood chemistry on people, right? Like I am trained in blood chem. And so it's kind of like this lady's like worst nightmare. And I'm like, you're essentially like telling me I'm being a bad mom, that my kid is going to go into shock, because blood sugar regulation is very important. You can die from low blood sugar. But again, I'm looking at the whole baby, right? I'm looking at the whole baby. The baby is like feeding the baby, like everything was really fine. And so it's just unfortunate that a lot of this is kind of how things happen oftentimes. But I think that we can prevent a lot of this from happening by having a really good team. So I had a midwife that was in my corner. I had a doula during the actual birth and leading up to it. And then I had my husband, who was also kind of, supporting me through all this. He was awesome. And so really having a team to support you, because you are emotionally, physically drained at this point after either a vaginal delivery or a C-section. And what a lot of these doctors are not trained in gut microbiome. They're not trained in nutrition. And for example, breastfed babies and babies that get exposed to gut microbiome have a lower chance of contracting RSV and rotavirus, right? Like this is evidence-based. And so I really think that nature got it right. And I am so grateful for modern medicine when there's an acute issue. But when it comes to childbirth, is not a medical event.
No,
it is. It's just not. It may be done in a medical setting, but childbirth is not a medical event. And the best thing that most doctors and nurses and nurse practitioners can do is get out of the way and let the body do things naturally. Instead, we have one of the highest maternal mortality rates in industrial nations. It's wild what's happening to women here.
Yeah.
I think it's important that we are educated on these things and that we stand in our power.
Yeah. Yeah. And I think that's important. I think that it's important we start talking about it. And unfortunately, with allopathic medicine, there's this expectation that in order to have convincing evidence, you have to have a randomized controlled trial. But that's unethical with mothers and babies. And so then what we have is this slow anecdotal evidence.
They don't have randomized controlled trials for any of the vaccines they're giving our kids.
Yeah, they do.
Not for most.
Yeah.
There aren't.
They have baby. No. With vaccines, they do. They'll have a group that's a control group and a group that's not a control group. And one group will get the vaccine and the other one will not. But you can't do that with babies and mothers. You can't say, okay, I'm going to give formula to this baby and then I'm not going to treat the blood sugar in this baby. And so it's anecdotal evidence. So yeah, that's what I mean by randomized controlled trials. So when you sign up a child for a vaccine randomized controlled trial, like when they had the COVID vaccine that was coming out, they signed up children to get smaller doses of the COVID vaccine. And some children didn't get it and you didn't know if you were getting it. So that's randomized controlled. But with delivery, for instance, they don't have a randomized controlled trial where you can give your mom Pitocin or just let her go. You have to make a choice. You have to deliver the baby and you have to deliver the baby in the safest way possible. You just don't wait it out and see if the baby just comes out on its own. If there's a need for intervention, if there's a need for C-section, or if the baby's not doing well, or if the mom's not doing well, you can't just not intervene.
Yeah, I think that there is, in some of those cases, you can't intervene, but then we have preventative measures that, often it's this kind of intervention cascade. And
of course, yeah.
For example, when it comes to, getting an IV, okay, so you'd think like, okay, that's pretty benign, right? I'm just getting saline water. Okay, so I get an IV. I now am, bloated. The baby is bloated. Their weight is artificially inflated. Now, all of a sudden, that artificial water weight goes away. Now it looks like the baby has lost way too much weight. Now they have to be, now they're in the NICU. Now they don't have as much skin to skin contact with mom. I mean, there's all of these interventions that lead to other interventions. And I think the difficulty is, how do you know what is what? Like, what is an emergency and what isn't an emergency? And I think that's where, the devil is definitely in the details.
Yeah.
I think that there is a philosophy with obstetrics that the doctor is delivering the baby. And I believe that the mother is delivering the baby.
Absolutely.
And I think that is a very big difference.
Right. And like you said with the IV, I mean, and I don't know how it is where you were at, but it's not standard for a cervical ripening induction to have any fluids going in their IV for any of the facilities where I work, because like you said, you can get fluid overload. We have to monitor intake and output and make sure that we're not giving too much fluid to this patient that's getting these interventions that we are providing, right?
Yeah.
Because you can get fluid overload. However, then if your baby starts to react in a way that looks as if they need some interventions, one of the interventions that we know can help is to give a fluid bolus. So then it's like the risks and the benefits have to be weighed. We try things first, like turning you and putting you in a different position that might help the baby get oxygen perfusion through the placenta and the umbilical cord. Right. If that doesn't work, we might recommend the fluid bolus, but we have the IV in place, the saline lock in place, so that we can have access to that intervention as needed. And just like on the same lines, it used to be standard to give oxygen when the baby was having what we call decels, right? So the baby's heart rate's going down. Well, now evidence has shown that not only, I mean, we've learned in nursing school that oxygen is a drug, and we don't just standard across the board give it to people, but we are giving 10 liters of oxygen by face mask to mothers in labor whose oxygen levels on the monitor were 100% just because the baby was having decels, because practitioners thought, oh, well, the baby looks better after we give oxygen. Well, maybe the baby looks better because we're turning and giving fluid and managing this labor appropriately versus giving oxygen. So we are learning. And as we learn, the evidence needs to be made available to mothers, because like you said, birth is not a medical process. It is a natural process. However, medicine has evolved somewhat to be able to intervene when it becomes an emergency in order to continue that birthing process in a safe manner. But then once we find out that maybe some of those interventions don't work as well as we thought, like the oxygen, it's no longer, the ACOG has come out saying that we no longer need to be standardized giving people oxygen when they're having a deceleration, then we need to do better. And we all need to do better. And we need to take that information and use it so that we can do better for people and so that we're not causing harm. And it's frustrating how slow allopathic medicine can be in implementing these policies. Because, and like you said, the nurses, we stay up to date on these evidence-based practices, and we know, and then we try to encourage hospitals to change. And it's just such a slow process for that to happen. And it's so frustrating. And it's frustrating that the consumer patient, the client, the mom, the family, the mother baby dyad doesn't necessarily have access to that information as readily as we do. And then they trust the hospital to do what is evidence-based. And it's not always the case.
Yeah. And like I said, the policies are often there to protect from litigation and liability. And if the system was great, right, we would have great outcomes. And we just do not have great outcomes in this country. And so I think that it's really important to look at the system and say, I either want to opt out of this system, which is what I tried to do. I didn't have one cervical check during any of my prenatal visits. That was something that I have a lot of trauma around that. My midwife is like, that's fine. I don't need to check your cervix. Yeah. My friends that go to OBs, they're constantly getting cervical checks. And my trauma is around a sexual assault and multiple IVF procedures. And it's just, there's a lot going on down there for me. And so, I think that we just give up control and power over our bodies. And I think that's something that we need to take back as women.
I think that's interesting that people are still being told that a cervical check is necessary. It could be presented as an option if you're curious to know.
And I need to see how far dilated you are, as if dilation is the only thing that impacts your ability to deliver a baby. And things are often presented not as options, or they're presented in a way. I had a friend whose OB literally told her that if she doesn't get the flu shot, that if she got the flu, it'll kill her baby.
I mean, it's recommended to get the flu shot, but we definitely have people that decline. That's so interesting.
And you can recommend all you want, but to tell a mother that if she got the flu, her baby's going to die. It's like, come on, we got to do better in this country. And again, if the system was good and if the system was helpful, we would have better kind of normal outcomes. I'm grateful for the modern medical system in acute issues. Like if I have a broken leg or a heart attack or a stroke, right? I think it's great. But when it comes to like preventative medicine and it comes to getting and keeping people healthy, it's not the right system. And I think that's where folks that are practitioners, that are functional medicine practitioners or functional nutrition practitioners like myself can kind of step in and help in that regard.
Yeah. Well, and I think that there's reasons for and there's reasons against everything, and it needs to be tailored and individualized. Like if you are high risk because you have some sort of underlying medical condition and it's more recommended for you to get the flu shot, then maybe there needs to be more education there. But if you're low risk and just decline the flu shot because you've looked at the evidence, it's not right for you. Now, it's not something that I personally recommend. I always get my flu shot. But, if somebody comes in and says, no, I declined the flu shot, I just move on.
Yeah. And the interesting thing is I've never had a flu shot in my life, and I'm not going to start something new during pregnancy. And so, again, like how we present things, I think is really important. You can present something as an option, but if you pressure somebody and make them feel like they're being a bad mom or they're going to hurt their child, that's not really ethical in my perspective either. So
no, not at all. And I mean, I can hold evidence in my brain, right? That makes me feel like I want to further educate a person on why I strongly feel like this option would be best for them. And I can do it in a way that isn't bullying.
Correct.
And I think that saying that your baby is going to die, it sounds like we're intentionally trying to be shocking.
Yeah.
And there's ways to say it, to take the time to say it and educate and try to strongly impress on this patient why you think that this is the best option for them, but they still have the right to decline because,
Of course.
people don't necessarily make what you consider to be the right decision all the time. And that's part of life. My biggest beef with medicine right now, and mostly it's because of insurance companies, is that they don't give practitioners the time to explain these things.
Yep.
Visits are supposed to be 15 minutes. You can bill for like 15 minutes. And that is insane.
Yeah, no, on average, I see my clients have seen 12 doctors that have told them everything's fine, labs are normal. And in the meantime, they have insomnia, anxiety, depression, IBS, eczema, psoriasis, many markers for autoimmune disease. And on average, my clients have seen 12 doctors and they either refuse to run labs or they run basic labs that don't do much. And they say, oh, everything's normal. Everything's in range.
Right.
And I don't even know if the doctors know that the range is just telling you what's common. It's not telling you what's optimal.
For like 160-pound man.
Exactly.
Even the pregnancy lab.
Again, I'm dealing with a population of women who looked to their doctors and their medical community for help, and they are ignored, oftentimes are told that they're lying, specifically around like weight gain, where they say, this is what I'm eating. And the doctor says, you must be lying, or you must not be telling me everything, or you must be sneaking some Oreos here and there. I mean, and the reality is they've like no estrogen, no progesterone, no testosterone, some major weight gain, and some things that, the doctor just never even was able to identify. And so I think that it's really important to have access to a medical team that has other tools in their toolbox.
Yeah. And unfortunately, with allopathic medicine, you specialize. And that's your only wheelhouse. And so if somebody falls outside of those very specific lines, not every practitioner has the ability or the access to get the information. And I think that's where functional nutrition comes in, because it's not necessarily a condition that fits into a box that you're treating.
Yeah. And, I think a lot of the benefits of functional nutrition or functional medicine is that we look at the body as a whole. And we don't chop up the body into systems. And so for me, I am looking at the body as a whole. I am running labs that paint a picture of what is happening in the entire system, because every single system impacts the other systems. And there isn't like a nice, neat border around certain things in the body. Like everything impacts everything. And so I think that's really important to work with a practitioner, that if I see something going on with the skin, I 100% know something's going on with liver and gut. And I'm not sending my client to a dermatologist, because that eczema has nothing to do with your skin. It has everything to do with your immune system and the liver. So I think that having that type of training, which I don't think that's how it's done unless you're being functionally trained.
I have a couple questions for you, and I think it's going to kind of go off on a tangent either way. Both questions. The first question, I kind of want to go back to what you're talking about with the epidural, because like we were talking about, you have to weigh the pros and cons. There's no right way to do it, right? And I would imagine you had a spinal anesthetic, or you could have had a combined spinal epidural. And so then you weighed those risks and benefits with your anesthesia. Obviously, you didn't want to be completely unanesthetized for your C-section, and you didn't want to go under general anesthesia so that you didn't get to meet your baby after he was born. But then you talked about the effects of the spinal or epidural anesthesia on breastfeeding. So I'm curious first of all, I don't know a whole lot about how the spinal or the epidural, what it does to affect breastfeeding. So I have some questions surrounding that. And my mind's kind of going in a lot of different ways about how that would affect it. But when you were weighing the pros and the cons, what information did you have that you were weighing that you might be able to share with some of my listeners who may be deciding this too at some point?
So for me, immediate skin to skin, not just for I know we call it the golden hour, but it's really a golden couple of hours.
Oh, of course.
And to me, I know that immediate skin to skin, immediate on the boob, feeding, that connection, the smelling, the looking into the eyes, all of that, it helps map your nervous system and your child's nervous system together. And that was my number one priority. So anything that risked that for me and my child was off the table. I would have undergone 24 C-sections. I would have sacrificed anything in order to preserve that sacred time with my child, sacred emotionally, sacred biologically. That was like my number one, if I had like a single thing that I was really working towards. If I didn't have that intuitive hit that I was going to have a C-section anyway, I probably would have said, okay, let's continue with induction. But that's not, and this isn't evidence-based, right? A lot of this is, I'm a highly intuitive person. I know my body. And that is what felt right for me. And I think that at the end of the day is what I think we need to listen to is, does this feel right? That is why I didn't want to have an epidural to begin with. It's why I didn't want to have a hospital birth to begin with. I wanted to, because this is not a medical procedure, this is a natural process. I wanted to give my body the best chance to let the body do what the body does. And so that is why I chose. I also know people that have had ecstatic births, right? We can also kind of get into, I know women that have felt no pain during birth. And so then we can kind of get into a conversation around like pain. Do we as a society tell women that childbirth is awful and incredibly painful with every single book and movie? And then is the environment essentially ripe for a traumatic birth so that all of these women have traumatic births? And then we turn around and talk to our friends about how traumatic the birth was. Are the outcomes a direct result of the environment? I would venture to say yes, which is why I wanted to opt out of that environment. So that was my decision. I knew that breastfeeding babies is incredibly important. And I always look at good, better, best in my practice with my clients. And I believe that given normal circumstances, right, it is best to breastfeed your baby. But if you are having a mental breakdown because of the breastfeeding, then it is best to feed your kids some formula. And so you have to, I think so many times we detach the mother from the breasts, where it's like, yes, the breast milk is technically the best thing for the baby. Colostrum and breast milk is the best thing for the baby. However, that's only if the breasts are not attached to a whole human being who, has a lot of things, work or maybe access to postpartum care. Maybe they have a supportive partner, maybe they don't. Maybe, my husband had 4 months paid paternity time. I am lucky enough that I can choose when and how I work. Not everybody has these privileges, and I'm very aware of that. So, in isolation, is breast milk the best? Yes, it is. But when you all of a sudden look at like the whole picture, which is like, there's a human here, we need to have broader conversations around that. But for me, preserving breastfeeding was very important for me.
Oh yeah. And I think most of the moms that I work with, that is their goal. But then I do see those other things crop up. And I think it's really important to, like you said, to get that good, better, best and attach the human to the equation. And so then I guess where I'm curious is, so personally for me, my first delivery, I wanted to have a natural birth and I labored at home for as long as I could. And when I started feeling pushy, I went to the hospital. I got there, they told me I was 6 centimeters. And after several hours of laboring on my back in the most unoptimal, I wasn't quite as educated as I am now. I did ask for an epidural because I got to the point where I felt like my stress levels were so high that I was not going to be able to emotionally contribute to birthing that child.
Yeah.
My tension level was so high, I couldn't use my brain to relax my body anymore.
Yeah. And cortisol will halt the birthing process.
Exactly.
I mean, the cortisol
or dysregulate. It was dysregulating my birthing process. And I think that also my dehydration was not helping. And so that's where I wish personally that some of those interventions that I didn't know that I had access for. So this is kind of the flip side, because I want everybody to know what the tools are And we can't go into all of them today, obviously, but know what the tools are and what they're there for. I wish that I had had someone say, oh, would you like an IV bolus? Because then my blood pressure dropped. And this isn't standard the way that they did it when my daughter was delivered. I've since learned that you're supposed to have that IV bolus before the epidural, and I wasn't given that. And, laboring on my back wasn't optimal on a stretcher also.
Laboring
I was
on your
doing
back
great at home.
isn't optimal anywhere. It's just,
right.
I mean, I'm a classically trained, all apparatus trained Pilates instructor. I understand like the pelvis, the pelvic turning your knees out, right? We're constantly turning knees out for moms. It literally is making your pelvis clamp down around the baby.
Smaller,
You can go knees in, feet out, right? And still give room. So yeah, I mean, it's wild. It's wild that all this stuff happens. I wish it didn't.
Right. I really want moms to know what their options are and why that it's across the board. So what I see is both sides, right? I see across the board, somebody will come and they will just say no to everything. And I see that as them shutting down and trying to protect themselves. But did they necessarily know the reasons that they have access to these interventions? But I also get why we're shutting everything down, because the culture is so cloaked in this power struggle, in this environment where we take autonomy away from moms, that I get why they come in defensive.
We no longer trust the modern medical model.
Right.
We just don't.
And it's not perfect. I'll give you that. But there are interventions that are sometimes helpful. And I guess my goal when I'm treating my patients is to try to kind of do what your nurses did and say, I get that you're fighting for what you believe in. And I want to give you that power. And maybe the way that we're suggesting isn't the best way. It's just hospital policy or this nurse practitioner's preference. And it infuriates me that there are people that don't have resources that are in this environment and aren't given the best options.
Absolutely.
And it hurts my soul.
Same.
And then the other question that I had for you. So I know you said that you have online programs, and we're talking about people that maybe have limited resources. I would imagine that someone with limited resources might not be able to work privately one-on-one with you. But if someone wanted to improve their health through functional nutrition, are there options that you provide that are a little bit more self-driven, but also could help them kind of get on the right path if they didn't have the means?
Yeah. I mean, I'll tell you 3 things that you could do right now. And all of this is covered in, I have a program called the Adrenal Detox. And the adrenals are part of your autonomic nervous system and kind of that fight or flight or rest or digest mechanism in your body. We want to obviously spend the majority of our time in rest and digest. We do not want to be in fight or flight. But our modern world puts us in constant acute stress, prolonged acute stress. And cortisol is a catabolic hormone, which means that it breaks you down at a cellular level. So it's great in small quantities when you're trying to run away from the saber-toothed tiger. But now in our modern worlds, whether a stressor is physical, biochemical, or emotional, the body doesn't know the difference. And the response is the same, surge cortisol. And what ends up happening when you're in this constant state of fight or flight, your autonomic nervous system essentially prioritizes everything that it perceives as necessary for short-term survival. So getting more blood to your big muscle movers so that you can run away from the saber-toothed tiger, getting more oxygen, dilating pupils, but things are deprioritized. And the things that are deprioritized because the body is always trying to find balance are things like your immune system, because it doesn't matter if you could fight cancer if the saber-toothed tiger eats you. Right. Things like digestion. It's why oftentimes when we're scared, we empty our bowels or our bladder. Reproduction. I mean, there's so many women that can't get pregnant, can't stay pregnant. It's because they're in a constant state of stress. Cortisol literally turns things off that are necessary for long-term survival, like DNA repair, reproduction, all of those things. And it prioritizes short-term survival. And so getting out of a state of fight or flight is incredibly important. And there are a couple of very simple things that you can do. The first thing that you can do is get morning light. So, and these are free, right? Like it costs a lot of money to work with me, but these are things that are free. I'm just telling you about it, right?
Yeah.
And these are things that I do with my clients right away, which is, are you getting 15, 20, 30 minutes of light in the morning, optimally within an hour or so of sunrise, and then also of sunset? Are you eating a high protein, low carb breakfast within 30 to 45 minutes of waking up? Very, very important. And then sleep hygiene is so incredibly important. Minimizing red light. Don't have, follow patterns of the sun. So when the sun goes down, you shouldn't have every single canister light in your light on, right? Not having access to blue light, your phones, your screens, having your room nice and cold when you go to sleep. Some basic, look up sleep hygiene on the internet. And I cover all of this stuff in a really inexpensive workshop called the Adrenal Detox. And those are just 3 things that you can do, in a matter of minutes a week that I think are really important.
Yeah, that's awesome. Normally at the end of the episode, I will ask a mom, if you could go back and talk to yourself before this journey, what would you want to tell yourself? It seems like you came into this journey very in tuned to your own body and your own desires and very educated. So I'm not sure if there's anything that you would want to go back and tell yourself, but I'm wondering if maybe if you went a little bit further back to like before starting this journey, if there is something that you would want to tell yourself just because it's helpful for new moms that are starting their journey to hear what people wish they'd known.
Yeah. For me, I didn't have anybody in my life that had a positive birth story. So with every movie that I watched, Knocked Up, where there's screaming, in pain, purple pushing, sweating, swearing at your partner, you did this to me, and then all of the traumatic births that my friends have had, and also how awful their postpartum was because they didn't do the work that they needed to ahead of time in order to have a healthy pregnancy, like balancing minerals, like a spore-based probiotic, prebiotics, like all of these things, reducing stress. Really didn't touch on some of that stuff, but it's like so important. So I had this negative perception of the childbirth. And that was probably one of the reasons I prolonged it so long, because I was terrified. I had this very logical fear of birth because of my experience in the medical system, the stories that were seeded by my friends and family. And I wish that I had access to some of this information earlier, because then I would understand that like my body was born to do this. And it's the most rewarding thing I've ever done in my entire life. And maybe I wouldn't be 45 dang years old, trying to keep up with the 5-month-old and wanting to have additional children with my husband. And so, I think that would be something that I would tell myself. And then also the importance of minerals. I wish I would have I even knew this, but like I just didn't start early enough. I do a hair tissue mineral analysis on all my clients. My prenatal was a custom mineral blend that was tailored specifically to me. And then I did another custom mineral blend when I was breastfeeding, so I kind of had three custom mineral blends before I got pregnant, when I got pregnant, and then when I was breastfeeding. And I think that is so important. Minerals are like the spark plugs to your body. Literally every single metabolic process in your body needs minerals. Magnesium, which is one of our primary minerals, is responsible for over 600 metabolic processes in the body, like DNA and RNA production. Literally, as you are growing a human, you need massive loads of magnesium. And then also understanding that you also need to have a balance between minerals. I think it is a tragedy that doctors do not understand about the importance of minerals and micronutrients in general. So your vitamins, your minerals, your amino acids, and your essential fatty acids. And I wish I would have started balancing my minerals more quickly, because I kind of I maybe started doing it 6 months in advance. And I should have done it probably a year or 2 in advance.
Yeah, that's so important. Yeah, I feel like your typical prenatal vitamin doesn't, it's kind of a joke.
Well, your typical prenatal, for example, has folic acid in it. There's estimates that 40% of women have the MTHFR gene mutation, which does not allow you to methylate. And so you can't methylate it. And so, understanding the importance of a good quality, like prenatal, using a methylated folate, it's already in a bioavailable form. So I think all of these things are really, really important. But again, doctors don't know. And they're like, yeah, just take a Centrum 1 a day or whatever, that some garbage, or take magnesium, but they're taking magnesium oxide, which only 4% is bioavailable, right? So it's like really understanding about minerals and micronutrients and really preparing the body for birth, because your body depletes you of about 20 to 30% of all of your minerals with every single pregnancy. So now imagine you're a mom on your second or your third pregnancy and you're like so depleted. And that's where we have a lot of issues with the postpartum depression, anxiety, and all of those things, the hair loss, just complete dysregulation in that fourth trimester and beyond. So I think those are the things that, I would tell myself, which is your body was built to do this, and don't be afraid of it. Lean into it, enjoy it. Childbirth can be awesome. Nobody ever told me that.
Mm-hmm. Yeah. What form of magnesium is better than magnesium oxide?
There's a couple. So magnesium glycinate is great. There's 9 plus different types of magnesium. Oftentimes it's also magnesium citrate, which is great if you are having a hard time going to the bathroom. Number 2, you've got to take the right form. And I think so often people are just kind of like piecemealing things together from like a podcast or an article or a TV show. And I think, preparing yourself for birth is important, and find somebody that can support you in that. I'm working with a client right now who just had her 4th IVF retrieval, has had really low quality eggs and embryos. And, she made the decision to not implant the embryos that she does have based off of some of the labs that we just ran. No calcium, no magnesium, off the charts sodium and potassium, which means she's in a hyper stressed out state. She has off the charts mercury levels.
Wow.
Off the charts mercury levels.
Because
because mercury is in our mascara, our makeup, our contact solution. It's in vaccines that, forms of it have been in definitely vaccines that I took as a kid. It's in our water. It's in everything. And if you don't methylate, it means that you don't detox appropriately.
Yeah.
So now that toxin barrel is already filled and you can't empty the barrel. Right. And so, and a lot of these IVF doctors, they're not incented for a healthy outcome. They get paid by how many retrievals they do and how many implantations that they do. So they're not really incented to make sure that you can stay pregnant and and they're not incented to see whether or not you absolutely lose your mind after, in your postpartum. So working with somebody that is kind of incented to, make sure that you are happy, healthy, and whole and living a big life, I think is really important. And just getting a team around you that can help you with that. And so, she's decided to hold off on implanting these embryos until we can work on reducing the stress and inflammation in her body, which I think is really, really important.
Yeah. Well, Maja, is there anything that we didn't cover that you wanted to talk about?
I think that there are 2 really important things that I would leave with all of your listeners from a kind of preparation perspective. Is healing the gut microbiome. And if we have the autoimmune rates that we do in this country, we know that that's related to gut microbiome. Like in order for an autoimmune condition to pop off, a couple things have to happen. The first thing is that you have to have a genetic predisposition. The second thing is that you need to have gut permeability. And then the third is you need to have a stressor. And oftentimes that stressor is physical, and it's childbirth. So oftentimes after childbirth, when you have those 3 things that are kind of happening, is when a lot of women get Hashimoto's or rheumatoid arthritis or one of the other autoimmune conditions that are out there. And a lot of that can be prevented just because you have a genetic predisposition, right? Your genetics load the gun, but your environment pulls the trigger. And so healing gut microbiome, running a couple of labs, to see what's going on with your gut. Do you have gut dysbiosis? Do you have an overgrowth of bad bacteria and not enough of the good bacteria? Do you have, loose, tight cell junctions in your gut where all the bad stuff is literally escaping the lumen of the gut and through the bloodstream and kind of implanting into extra intestinal sites like the joints or the brain? Really understanding that before pregnancy, and then and also balancing minerals are 2 of the most important things that you can do, not only to have a healthy pregnancy, but a healthy baby, but also a healthy postpartum where, you aren't struggling with anxiety and depression and those kinds of things that seems to be rampant today.
Yeah, that's so important. Well, Maja, thank you so much. I feel like I've been overloaded with information, but it's great information, and I can't wait for my listeners to hear this and get started on finding their way to health through nutrition.
Thanks so much for your time. I appreciate it.
Thank you so much for tuning into my podcast. If you enjoyed what you heard, make sure you hit that subscribe button so you don't miss out on future episodes. Don't forget to share the podcast with a friend who can benefit from the valuable insights that we share here. And if you could take a moment to leave a 5-star rating and review, it would mean the world to me. If you're ready to work one-on-one with me to embark on a transformational journey towards a confident and empowered hospital birth experience, go to kellyhoff.com/empowered and enroll in my Empowered Hospital Birth Coaching Program. Together, we'll create a roadmap to a birth experience that you'll cherish forever. That's KELLYHOF.com/empowered. Let's make your birth experience extraordinary.